TMJ is a broad term that people use to describe what could be 50 different conditions. You'll hear tons of people that'll say, I have TMJ. Well, what does that mean exactly? I mean, it takes a person with some specialized training to determine exactly what that means for each person. But in a nutshell, when somebody says they have TMJ, an easy way to remember that it is an imbalance in the teeth, the muscles, and the joint. That's the way I remember it, and most people can remember it that way. So if there's an imbalance in there, they might have a condition where that it's caused a problem where they're having headaches and that sort of thing. So in our practice, we're primarily focused on their teeth, but also it could be their head and neck. So we treat a lot of what we have coined TMJ headaches. And what that refers to are people who have headaches that are related to an imbalance in their teeth, muscle, or joint. Now, a lot of people that we see, and the people that we are most able to help, are people who have chronic headaches, but that they have already seen a neurologist, so that they've ruled out that there's not a neurological problem that's causing these headaches. There's 200 different things that can cause headaches or triggers. And many of those can be neurological. We also encourage those people, a lot of times if I see them, they haven't seen a neurologist, I'll encourage them to see a neurologist or an ear, nose, and throat doctor, because sometimes it can be related to their ear, nose, and throat, maybe their sinuses. But if someone has seen a neurologist and they've been to an ear, nose, and throat doctor, and both of these doctors have said, it's not, we can't really discern exactly what we're going to do, we don't know why. Most of the time, it is a force imbalance problem that's going on with their masticatory system or their teeth and the functional structures that are attached to their teeth. So for those people that have those headaches, we have a very comprehensive system. And the first thing we need to do if someone suspects that they have a TMJ migraine condition is they have to come in and be evaluated, and we can do that painlessly with an x-ray that goes around their head and it shows us the joint, and we also have a computer generated force movie that we can make where we just have them bite on something and it shows me the way their teeth come together, the amount of force that each tooth is generating, and then the pattern of that force imbalance. So it's a real simple way to diagnose that. Once they've been diagnosed, the system that we use is a very comprehensive system. It's more comprehensive than anything that I'm aware of in the United States, maybe in the world for that matter. When they're treated with massage therapy. We do low light laser therapy on the muscles, which what the laser does is it increases the ATP, which increases the muscle's ability to heal itself. We do alpha stim, which resets the neurological pathways for pain there, and we also use ultrasound. And then in addition to that, we may need to equilibrate their bite or rebalance their bite, and that might involve me having to go in and mark their teeth and do a little adjusting. It may involve doing some dentistry. Not everybody has to have their whole mouth rebuilt, but a lot of times they need some dentistry to kind of even things out. But it also involves some home therapy things that these people have to do at home. But again, it's not just one of these things that works, it's all these things that kind of work in synergy with each other. And for the people that we have treated, we have had tremendous results. If they've been diagnosed properly, these people a lot of people have had these headaches for 5 or 10 years, and now they are, I wouldn't say they're cured. I would never say they're cured, but what we have been able to do, and I can say this comfortably, is that we can decrease the intensity of the headaches and the frequency of the headaches. And for most people, that's enough. For many of them, we've been able to wipe them out completely. There's a lady named Linda who has actually been a patient of ours for a long time, and she developed these headaches, which I wasn't aware of, but she had been to the various doctors and couldn't figure out what was going on. And it was really, she had missed work, and it was affecting her life pretty. I wouldn't go so far as to say it was debilitating, but I guess there were times that she would call into work with migraines, and So it was definitely affecting the quality of her life. And we were easily able to, once she revealed that, I gave her a questionnaire. She answered some questions for me. We took an x-ray. And then we did this computer-generated force analysis, and we were able to determine that she did, in fact, have the condition that we can treat. And once we put her through our 12-week program, she was symptom-free, and she has been, in fact, symptom-free ever since then. Now, one of the things that we encourage people that have been through the treatment, the 12-week treatment, is to come in periodically and sort of or maintain their therapy. So they may come quarterly, they may come monthly, depending on the person's situation before they started. And she's continued on and been symptom-free for several years now. So Linda in particular was a wonderful case, and I was very happy to be a part of that and help her. She's a very, very sweet lady. So when a person comes in with this condition of the TMJ migraine, as I've defined it, we've been able to help them really get their lives back in a lot of situations.